Hello, my name is Megan Bogart, and my project proposal presentation is on medication-assisted treatment. The opioid epidemic is an enormous issue in the United States and around the world. Of the 20.5 million Americans 12 or older that had a substance use disorder in 2015, 2 million had substance abuse disorder involving prescription pain relievers, and 591,000 had a substance use disorder involving heroin. Drug overdose is the leading cause of accidental death in the United States. Opioid addiction is driving this epidemic, with 20,101 overdose deaths related to prescription pain relievers and 12,990 overdose deaths related to heroin in 2015. Overdose death rate in 2008 was nearly 4 times the 1999 rate. Sale of prescription pain relievers in 2010 were 4 times those in 1999. And the substance use disorder treatment admission rate in 2009 was 6 times the 1999 rates. The purpose of this project is to decrease relapse rates of substance use disorder in participants, increase clean urine drug screen numbers in participants, provide information and therapy to participants to have better coping mechanisms, and to prove that medication-assisted treatment is the gold standard for substance use disorder. The target audience for this project includes adults over the age of 18 who meet DSM-5 criteria for substance use disorder. It does not matter if the patient is male, female, and the socioeconomic status does not make any difference either. This is a disease that can affect anyone. Even babies are being born to mothers that abuse these substances and are coming out addicted, all the way up to the elderly. The significance of this problem is that as a psychiatric mental health nurse practitioner, there will be many patients that need treatment for addiction. Knowing what works, what has better outcomes, and what is evidence-based is important for any healthcare provider. With an issue to this degree, it is important to know how to treat the patient and have lasting outcomes, and help as many people suffering from addiction as possible. My synthesis of relevant literature includes 3 Level 2 studies and 1 Level 4. Mokri et al. Shows that the advantages of buprenorphine compared to oral naltrexone, including its great ease of induction and its association with higher treatment retention and greater total duration of opioid abstinence, and supports the dissemination of buprenorphine treatment. Hesser et al. Shows that further study is needed to identify factors and strategies influencing buprenorphine retention, particularly during the first 30 days of treatment, to help in efforts to improve engagement and retention. Rosenthal et al. Found that the 24-week retention rate for active treatment was significantly higher than placebo and within the range observed in other clinical studies of buprenorphine. Vo et al. Study results add to support for effectiveness of programming that integrates relapse prevention medication for opioid addiction and to offer choice of treatment medication to participants. Proposed intervention plan starts with finding participants. This will be done by providing flyers to doctors' offices in different treatment centers, online postings regarding the study, and word of mouth to people known to have substance use disorder. We will obtain written consent and informed consent by giving information about the study to participant before beginning. Phase 1 is the induction period, and this includes the participant arriving in total withdrawal from opiates, and this will be measured using the Clinical Opiate Withdrawal Scale, or COWS. The prescriber will prescribe buprenorphine or naltrexone, and we will provide cognitive behavioral therapy. Phase 2 includes monthly visits, where we will obtain urine specimens for urine drug screens and give cognitive behavioral therapy in groups or individualized therapy. Phase 3 is the final stage that has the parting survey, and possible treatment continuation. The final stage is synthesizing and disseminating our information. We will look over all outcome measures and synthesize the data, and then we will disseminate this data through publishing an article, going to research conventions, and visiting drug treatment centers. The proposed evaluation measures for this project include intake assessment form, clinical opiate withdrawal scale or COWS, urine drug screens, and the parting survey. The intake assessment form will ask participants about their current drug use, medical history, medications prescribed, and their demographics. The clinical opiate withdrawal scale is an 11-item scale designed to be administered to monitor common signs and symptoms of opiate withdrawal and monitor these symptoms over time. The sum score for the scale can be used to help determine the stage or severity of opiate withdrawal and assess the level of physical dependence on opioids. The urine drug screens will be obtained monthly and will utilize LabCorp, which detects drugs using immunoassay, ELISA, and thin layer chromatography for most of the initial testing, and mass spectrometry confirmation of drug metabolites. An additional drug screen for buprenorphine is ordered for those on buprenorphine to confirm that they are taking the drug as prescribed. The parting survey will ask participants what they liked or did not like about the study and if they would like to continue treatment. Thank you for listening to my presentation on medication-assisted treatment, and I hope you learned something here today.